안녕하세요. 서울대학교 보라매병원 이호입니다.
Greetings, I'm Dr. Iho of Seoul University Boramme Medical Center. Today I want to talk about OneCAS kit for maxillary posterior region. OneCAS system is a combination of existing OneGuide system and CAS system together. The process is similar with OneGuide system. Before surgery, design is done using digital dentistry and template is used for surgery. Because this is sinus crystal approach, in simulation stage before surgery, we need to understand the height of minimum and maximum remaining bone. And this should be used for actual surgery. When we look at minimal remaining bone, we can determine the depths of initial twisted drill. Minimum remaining bone height minus 1 millimeter equals initial drilling depths. The maximum remaining bone determines the final drilling depths. Let's look back on two advantages of CAS technique. Unlike the existing osteotome technique, penetration of sinus floor is done without sinus membrane perforation. The cortical bone is perforated. The cortical bone is penetrated without sinus membrane perforation. And drill is used here. Membrane elevation is done, not with osteotome, but it utilizes hydraulic lift. And such advantages have been reflected in OneCAS kit. Cutting edge drill from CAS kit and guide barrel from OneGuide kit have been combined to create OneCAS drill. The drill from CAS kit and guide barrel from OneGuide kit are combined, and on top there is stopper. This is the drill that is included in OneCAS kit. In addition, there's guide barrels for hydraulic lifter and bone carrier as well. There are two major differences between CAS kit and OneCAS kit. First, there is difference in stopper labeling. Stopper labeling in CAS kit to range from 2 to 12, and these numbers mean the drilling depths. It refers to the actual drilling lengths. For instance, if you add a 6 millimeter stopper on a drill, then the amount of depth that is drilled is 6 millimeter. On the other hand, the stopper labeling in OneCAS kit is different. It refers to the stopper length itself. If the labeling is from 1 to 9, for instance, if you're using 4 millimeter stopper, the actual length of the stopper is 4 millimeters. Let me tell you once again, the stopper in CAS kit, for instance, if you're using 6 millimeter stopper, then it means that the length that is actually being drilled is 6 millimeters. On the other hand, in OneCAS kit, if you're using 4 millimeter stopper for drilling, this means that the actual length of stopper is 4 millimeters. And this does not provide information as to how much drilling that is being done. In order for us to perform surgery smoothly, we need to understand how much millimeters we're drilling. And this information is also included in OneCAS kit. Before I go into that, I want to look at the difference between the drills. The diameters of OneCAS drill and CAS drill are the same. As for cast drill, the cutting edge is 13 millimeters, and it's the only option. As for OneCAS drill, there are two types, 7 millimeters and 10 millimeters. As for 7 millimeter OneCAS drill, this is used when available bone height is less than 7 millimeters, and 10 millimeter OneCAS drill is used when available bone height is 7 millimeters or more. Please remember the figures 7 and 10. For instance, if you use 7 millimeter OneCAS drill with 4 millimeter stopper, then you can calculate how much drilling that is done. 7 minus 4 is 3, thus drilling depth is 3 millimeters. For instance, so when you use a 10 millimeter OneCAS drill with a 4 millimeter stopper, then it is 6 millimeters. 6 millimeter of drilling depths can be achieved. This is just a simple calculation. This is irrational. This is irrational because when we do surgery, we make a lot of considerations and put a lot of thought to it. But to do simple mathematics on top of that, it's quite irrational. In OneCAS kit, the calculations are all already there. You do not need to do calculation, and the results are already in OneCAS kit. The middle is the stopper line. Let's expand on this image. For instance, 7 millimeters or more. In the blue line, there's 4, and in red line, it says 7. This is what I've explained about. The blue line refers to the drilling depth when 7 millimeter drill is used, and the red line refers to the drilling depths when 10 millimeter drill is used. This red line also refers to the length of depth gauge when this stopper is used. When we do surgery, we choose a stopper as we proceed. When you choose a stopper in OneCAS kit, do not look at this number, but look at these numbers. If you think you need to drill 4 millimeters, you need to find number 4 and use the according stopper. I believe you will not get confused in this way. This is depth gauge included in OneCAS kit. Unlike the general depth gauge, there's guide part. On the scale, there's 0 to 10. Precisely speaking, there's 0 to 8. For instance, if you're going to use 3 millimeter stopper, then 10 minus 3 is 7 millimeter. This is the length of depth gauge. Let's look at the second difference between CAS and OneCAS kit. The length of 2.2 twisted drill is different. As for CAS kit, on top of the labeled length, you need to add 0.6 millimeters of Y dimension length. So it is slightly longer than what is labeled. In the case of OneCAS drill, it is 1 millimeter shorter than what is labeled. If it is 7 millimeter drill, the actual length is 6 millimeter. If it is 10 millimeter drill, it is 9 millimeter. Yes, we need to consider 0.6 millimeter of Y dimension. As a result, the actual length of the twisted drill in OneCAS kit is 0.4 millimeters shorter than what is labeled. In the case of 7 millimeter drill, it will be 6.6 millimeters, and as for 10 millimeter drill, it will be 9.6 millimeters. Moving on to the overall order. Basically, it is similar to OneGuide system. Foundation is similar to OneGuide system. It is basically designed for flapless surgery. First, you need to remove soft tissue using tissue punch. You do drilling, hydraulic lift, grafting, followed by implant placement. If you look at drilling sequence, for instance, if the available bone height is 4 millimeters and if it is normal bone, let's assume that we are going to place the 4.0 by 8.5 millimeter implant. The drilling order is as shown. The available bone height is 4 millimeter. The initial drilling should be done up to 3 millimeters. 7 millimeter twist drill can be used with stopper labeled 4, and in that case, 7 minus 4 is 3. 3 millimeters of drilling can be done. As mentioned, you do not need to calculate this. You need to look at number 3 and choose the stopper accordingly. You need to look at number 3. and choose the stopper accordingly.
스타퍼를 골라서 끼우면 되니까요. 이런 식으로 같은 높이 드릴링
While maintaining drilling depths, you move on to twisted drill 2.2 to 2.8, and at penetration stage, you move on one step deeper while widening diameter by one step also. Penetration check is done. If the available bone height is 4 millimeters, you cannot do 4 millimeters of prep to do sufficient penetration. You need to drill up to 5 millimeters, so plus 1 millimeter. You need to do penetration check thereafter. This is the drilling sequence. Let's look at a patient case. This is a female patient who is 61 years old. The patient has diabetes and osteoporosis. The upper anterior and upper left posterior area shows defects. OneGuide system was used to plan treatment. Today's topic is OneCAS, so let's just focus on the posterior region. In number 6 and 7, we can position implants in this way. We need to measure minimum and maximum remaining bone, and we need to utilize these figures when we actually do surgery. As a result, in number 26 and 27, TS 5.0 by 8.5 millimeter implants were to be placed because lack of available bone height, OneCAS kit was used. This is surgical clip. Please note that the minimum remaining bone is 4 millimeters and that maximum remaining bone is 8 millimeters. In number 26, systemic anesthesia was performed. This was because the patient had a severe fear of dental treatment. That being said, if you look at the treatment plan itself, systemic anesthesia was not really necessary. Guide is fixated because this is a free end case. The anchor was used because there was sufficient keratinized tissue. In number 26 and 27, flapless surgery was performed. A tissue punch was used to remove the soft tissue. I want to focus on drilling sequence in number 26. Flattening drill is used to make the bone flat to help find the drill position that's going to be used thereafter. Before proceeding, you need to think once again in which order you're going to use the stopper. 2.2 by 7 millimeter twisted drill with a 4 millimeter stopper is used, so actual drilling depth is 3 millimeters. And it's the same for number 7 as well. I want to focus on number 6. The drilling depth is maintained, so I increase the diameter to 2.8. And then 3.1. Drilling depth is currently maintained at 3 millimeters and diameter is increased to 3.8. 4.1 is a final drill, so in next stage, penetration is going to be done. Number 7 is addressed as well. In number 6, diameter 4.1 by 5 millimeter, depth drilling is performed. Gradually, 6 millimeters and 10 millimeters are used, and it is drilled up to 7 millimeters and 8 millimeters. After that, implant is placed. It's the same for number 7 in the same order. Implants are placed in other areas as well. Anchors are removed and template is removed. I am checking how implants have been placed. Yes, you can check the implant placement depth with the guide on, but you can also adjust it without it because the path have already been defined. Implant driver can be used to adjust implant placement depths. Once appropriate placement depths have been secured, healing abutments are connected, and surgery is closed off. This is after surgery and prosthesis delivery. This is pre-op image. You can see on CT image that implant has been placed nicely. In the video that I've just shown you, I've used OneCAS but did not do bone grafting because maximum remaining bone was 8 millimeters. In this case, you do not need to do bone grafting. This will not affect the long-term prognosis of implant. Now I would like to summarize. OneCAS kit is a CAS kit in OneGuide form. The difference with CAS kit is that the labeling way of stopper is different. The number indicated in the stopper in OneCAS kit refers to the length of the stopper itself. If you want to know about the drilling depths, you need to look at the numbers written in blue and red in OneCAS kit, rather than number 3 stated here. Look at the numbers in blue and red. The numbers shown in blue and red indicate the actual drilling depths. Twisted drill length is 0.4 millimeters short than what is stated in the label. This is what I've prepared thus far. If you're interested in more in-depth knowledge and meaningful hands-on course, please refer to offline master course. I look forward to your keen interest. Thank you for watching.